Verifies the physician order for the prescribed medication. Checks the patient's medical record for an allergy or contraindication to the prescribed medication. Performs hand hygiene and dons non-sterile gloves. Selects the correct medication and compares the label to the order in the patient's medical record. Checks the expiration date on the medication. Visually inspects the solution for particles, discoloration, or other loss of integrity. Chooses equipment appropriate for the medication and injection site. Checks or calculates the dose correctly and verifies as necessary. Withdraws the appropriate amount of medication, taps the syringe to expel any air bubbles, removes the needle used for aspiration and disposes of it in a sharps container. Attaches a new needle to the syringe. Verifies the medication at the proper time, the correct dose, and by the correct route. Confirms the patient's identity using at least 2 patient identifiers. Checks ID and asks full name. Introduces self and explains the procedure to the patient. Provides privacy by closing the door to the patient's room and/or drawing the curtain surrounding the patient's bed. Locates an appropriate injection site depending the amount of medication to be administered. Verifies the site is free of pain, infection, bruising, and abrasions. Positions and drapes the patient appropriately and asks to relax the muscle. Cleans the injection site with an alcohol pad using a circular motion outward, allows the skin to dry. Stretches or spreads the skin flat between the thumb and index finger to create a firm surface and to isolate the muscle. Inserts the needle quickly and smoothly deep into the muscle at a 90-degree angle. Aspirates for blood return if appropriate. If no blood appears, injects the medication slowly. If blood appears, stops the injection and prepares a new syringe with the medication and injects into another site. After administering medication, waits for 10 seconds and withdraws the needle slowly. Covers the site with a gauze pad and applies gentle pressure for 2 minutes. Assists the patient to a safe, comfortable position. Inspects the site for signs of bleeding or bruising. Monitors for any adverse reactions at the site for 20 to 30 minutes after the injection. Discards all equipment appropriately. Removes and discards the gloves. Performs hand hygiene. Documents the procedure, date, time, name of medicine, dose, route, and signature. Reports any unexpected outcomes.